So I wanted to talk to you briefly about when or why you might need to come and see us. When you're training, if you're active, some degree of soreness is kind of expected, and you really don't need to go and see a physio for just your normal aches and pains, post-exercise soreness, that type of thing. But there are times when you do need a little bit of extra input. Now, those times might be that you have a recurring pain after you do certain activities, or it's in a recurring place. So you're getting a knee pain, and especially a knee pain that keeps cropping up on a consistent basis. That's probably worth checking out. There might be something very simple that we can do, which doesn't require much intervention at all, but can actually solve the problem for you before it becomes any worse. The other time you need to see us is if it's really starting to limit what you're doing. Whether that's your training or it's just life in general, if it starts influencing what you can do week by week because you can't perhaps train and walk in the hills in the same week, or you're struggling to train 4 days a week and you really want to train that little bit extra more, you're having to limit what you're doing outside of work just because things are getting sore, then when it is limiting life like that, by all means, come and see us, because again, there's usually simple steps that we can take which can just solve those issues and get you back to being the best that you can be, really, because that's what we want to do here. We want to keep you doing what you love. If what you're doing is stopping you doing more of the things that you love, come and see us.